tackling unveiling DNA to editing it with CRISPR technology. From losing millions in war to discovering penicillin, saving countless lives.
From fearing polio to its eventual global eradication. From radical excision of tumors to the revolutionary promise of CAR T-cell therapy.
The 20th century had small steps for medicine, but giant leaps for mankind.
In a world precise and fast to look light years into the universe and microns into the cell, medicine has not seen a hurdle it cannot overcome. Makes one thing. Is there something ailing the masses of our country? To get our answer, we ventured out, and this is what we found.
Despite so many cutting-edge advancements, what are we not seeing? Are we still missing a piece of the puzzle?
These stories, shrouded in silence, all echoing in a symphony of regret, urging us to prioritize prevention above all.
What we just witnessed was but a drop in the collective ocean of global suffering. It pushed us to dig deeper, and we realized that the stealthy culprit infiltrating our lives went by the name of non-communicable diseases.
Non-communicable diseases are defined by the World Health Organization as chronic conditions, usually of long duration, caused by a combination of genetic, physiological, environmental, and behavioral factors. Of the names in the screen, you might recognize some of these
that he was at a high risk and was prescribed preventive measures. 45% of the patients with NCDs in our study were diagnosed only after development of severe symptoms, and 6% were diagnosed because of medical emergencies caused by the same. This highlights that the current state of prevention and early detection in our country is extremely lacking.
The government currently has programs aimed at tackling NCDs like NCDs, but when asked, 70% of people had no awareness about this. We aim to increase public receptivity to participating in these programs by holding public awareness campaigns. Most of the doctors we interviewed emphasized that the habits and knowledge of making healthy lifestyle decisions should be taught to young minds. Effective education of even one student needs that the knowledge would benefit not just them, but their siblings, their parents, and in the future, their own family. The Indian Academy of Pediatrics has set guidelines for turning a school into a health-promoting school, seeking to improve overall health and academics. We would strongly recommend that the government support this initiative and as many schools as possible adopt this.
Dr. Prem Sagar sir, HOD of General Medicine, said that while the current focus is on treating the patient who come with disease and managing them in hospitals, we are not focused enough on preventing the disease. If we prevent it, there is no need to come to the hospital, he says. But unfortunately, 47% of our study population believes that medication is the only way to address NCDs, and 60% abstain from any form of regular medical checkups.
When we planned for this day, we knew this might not be the catchiest topic here. However, we wanted to shed light on the health crisis that is going to define our generation. Our audience, as we see it, aren't just delegates at the conference. They are future doctors, future researchers, future policy makers, and above all, internal educators.
When you leave this auditorium today, if there is one thing we want you to remember, it is that your voice will always count. Your authentic knowledge will be the spearhead that drives forward the future of our nation and the world. Let us look back to how we started. Even after science has come so far, why do we stand still and wait for NCDs to catch up to us?
This war cannot be won passively. While pharmacopoeia can be the reserve tools, it is prevention that has to be on the front line. Together, we have to change how we think about medicine, shift our perspective of healthcare from reactive to proactive. Because health doesn't just happen in the doctor's office. Health happens in your kitchen. Health happens in your school. Health happens where we live, where we work, where we play, and where we pray.
Today, we stand here to remind you of the power we hold within ourselves, the power to shape our own destinies.
To defy all odds and become pioneers of our own health. To not just let life pass you by. Instead, take your own health into your own hands, not letting disease control you.
This is proactive medicine.
This is progressive medicine.
This is preventive medicine in its purest form. Sometimes taking a step back is a step forward.
What should be the impact of your study? What is the impact of your study? You have done a relevant subject. You have chosen your sample size. I leave it to statistician to answer those questions, to ask those questions. But my question to you is, how do you translate your findings so that they have some impact?
Thank you so much for the question, ma'am. Ma'am, firstly, the impact of our research is that we are getting down to understanding why prevention is not happening. We are finding the barriers and the reasons why people are not adopting to take these measures despite them being common knowledge. And as for in our college, ma'am, we think that medical students can be the link between doctors, the professors and the patients, ma'am. In OGH, usually because of such a high patient load, doctors don't often have the time to sit down and explain everything, counsel the patients. We think that we medical students can be the bridge between that gap, not just in OGH but in a general more public sense as well, ma'am.
So excellent answer. So I think the students should be involved right from the MBBS days and should interact with the patient. What changes will you bring about in your canteen? And what changes about exercise? Do you have provision of exercise in your college? So what do you plan to do in that area?
Ma'am, we have a wonderful gym, we have a newly built volleyball court, we have a basketball court, and every evening, everyone from first year PGs to even final year, first year UGs to final year PGs, everyone is welcome to come and play. And to answer the first question, ma'am, in our canteen, recently they've introduced started to introduce more healthy options like granola bars and protein bars. While that's a small step, I still believe it's a step in the right direction, ma'am.
So I think the part of study analyze what foods are purchasing from the canteen. But congratulations.
Thank you so much.
Congratulations, you have raised the silent epidemic, non-communicable diseases. We are not aware of it, but it is actually it is becoming more and more severe day by day. Then what would you tell for a general public? What recommendations you would give?
Ma'am, thank you for the question, ma'am. Ma'am, the general public, it is not just about having the knowledge to make those lifestyle choices. It is also having the mindset. Yeah, I have to take care of my health. Health is not a passive thing that God just writes down and it comes to us. In every religion, we believe that mankind has some free will. So I want the general public to realize to exercise their free will and to take control of their own health, ma'am.
What methods you will suggest?
Ma'am, a very simple alternative can be when you eat parathas, just replace them with jawati rotis. Such easily available and not financially very expensive solutions can go a long way. Thank you.
Excellent presentation. So from my department, I am a preventive medicine specialist. I am very happy with your presentation.
Thank you, sir.
Keep up the good work and be the change you want to be. So you have to start and change. You people, you are the future, so you should keep up. Very good.
Thank you, sir.
Excellent presentation and excellent piece of work. It's so relevant to today's society. But you spoke something about IAP recommendation about school, healthy school, like healthy lifestyle. So suppose tomorrow your sir says, okay, let's move out and go to all the schools and give some recommendations. What are 3 recommendations you give to schools, children?
Ma'am, the first recommendation would be to have a compulsory games period. In our school, we had a compulsory games period, but that always used to be taken over by some other teacher. So I think we should realize the importance of that 45 minutes of physical activity. One more thing would, this is from the guidance that the IAP has issued. One more thing should also be not just the teachers telling them about their health, but also student club. Peer-to-peer communication always works better. So if the student comes to you and tell you, please engage in exercise, please avoid oily food, you are much more likely to listen. That is the second recommendation. And third recommendation is to again, while your peers can be, you can rely more on your peers, the authentic knowledge comes from the experts only, ma'am. So when, for example, we have parent-teacher meetings, talking to the parents about not just the kids' academic health, but also their actual health. I think these small steps can go a long way. Thank you.